We've got a big vision. We're dreaming big. We are thinking about how to fundamentally create a ripple in the ecosystem. We all experience healthcare at different points in our life in different ways, and we are demanding that there's got to be a better way. In some ways, I think mobile is an analog thought. It's no longer about going and taking an application and making it mobile. The thought's around a point of view. The need isn't to introduce more computer screens, it's to leverage that point of view at the right time, for the right role, for the right person in a very mobile type fashion.
Our solutions are evolving to run on smartphones that are run on tablets. The consumers will be able to access their clinical data via smartphones and tablets, and our clients, so the users of our enterprise solutions, be able to access information and complete much of their daily workflows on smartphones and tablets.
Our mobility applications completely change the way people work, but it also changes the way they actually see a client's chart. The reality is that somebody who's going to a behavioral health organization for services is probably also going to a primary care hospital. It's so important to be able to see a true picture of a client's chart. Innovating, creating opportunities and ways for our clients to have access to that is very important.
We're about being truly aligned with our clients, and that means more than just talking to them, helping them put out fires when things are broken, but it really takes it to the next level and getting involved with them as a partner, getting to know what they do, what their goals are, even being at the strategic table with our client.
We try to work with our clients, we try to listen to what their needs are, we try to understand what their needs are. It's complicated out there, and we recognize that.
It's important for Netsmart to have partnerships versus a client-vendor relationship. Netsmart really is taking what our clients need and understanding that future and bringing the technology and also the different services, consulting services or outsourcing services that our client actually needs. That relationship with our client is key.
Our core job is to help our clients implement the solutions we have in a predictable fashion so they can take advantage of those technologies to improve their business. And what we've done is created a methodology called Plexus that allows us to create a highly predictable path through that work plan. The methodology is event-based. It defines the deliverables we need before an event occurs, what needs to happen during an event, and what deliverables are required after an event.
Netsmart is very passionate about innovating in an effort to help clients improve their outcomes. If we don't, it doesn't just affect one person, it affects millions of people. And that's just not acceptable. You can't let these people down.
Netsmart has provided different levels of software and provided different methodologies for those software. So taking an old legacy system and moving it to new technology, providing hosting services, being able to provide that revenue cycle management, finding ways to make an implementation go faster, becoming more innovative and creative in that way and working with our clients.
We've worked through Healthcare 1.0, which was the beginning of digitizing. We moved to 2.0, which was how do we begin to introduce technology as less of an equiper and more of an enabler. 3.0 is really about optimizing all of those things together. What's at stake is the person-centric approach that must happen in healthcare, not just for the person providing care, but the consumer.
It's why every day matters.